Maria, why are you not eating?
Mommy, I no appetite.
Are you feeling unwell? Maria, time for breakfast. Good morning, Maria. What happened to your hand?
I don't know.
Is this your dust allergy? It's so serious. Are you feeling tired?
Yes.
Do you want to eat first?
No.
It's okay, then you just rest. Measles? Is it that serious? Let's go to the clinic.
Come in.
Hello, doctor.
Hi, how can I help you today?
This is Maria. And look, there's rashes on her body.
Oh, may I know how old is your daughter?
She's 5 years old.
Is she experiencing other discomforts such as loss of appetite, sore throat or fever?
Yes, she's been refusing to eat since yesterday.
Based on her age and her symptoms, I think that she is having HFMD. Let me take some fluids out of the blisters to check for diagnosis. Okay, the report is out. I can now confirm that she has HFMD.
What is that?
HFMD stands for hand, foot and mouth disease. In Malaysia, it has become endemic with an incidence rate of 166.1 per 100,000 in 2019. This infection is a common illness caused by viruses of the enterovirus family, with the most common causative agent being the Coxsackie virus A16 and the enterovirus A71. This infection usually affects infants and children below the age of 6, but it can affect adults as well. This infection usually involves the hands, feet, and mouth, but sometimes the genitals and the buttocks as well. Has she been to the kindergarten, nurseries, or somewhere crowded recently?
Yes, doctor. She's now in kindergarten, and last week I brought her to the theme park.
That makes sense. The main spread of HFMD is through the contact with the fluid from the inside of the blisters, and also from the droplets spread from sneezing and coughing. Especially, children in the daycare settings are more vulnerable because they have so much more contact with people. Also, touching contaminated objects such as toys, eating utensils, and doorknobs can also get them infected. The nurse Matilda will explain more to you on the symptoms and treatment for this disease.
Alright, doctor.
Hi ma'am, let me walk you through the things that you should pay attention to. Other than the symptoms she's having right now, such as rashes on her hand, feet, and mouth, she might also getting fever and sore throat. For the treatment, as the doctor explained, the disease is caused by different type of virus and there is no cure for the disease.
What? What do you mean there's no cure?
Let me calm down first, let me explain it to you. Normally, the patient will recover within 7 to 10 days without any medical treatment. However, we will still administer some medicine to relieve the symptoms. We will be prescribing you with paracetamol that can relieve the pain and the inflammation of the ulcers. But remember to never give aspirin to your daughter as it will cause a rare and serious disease called Rey syndrome, which will cause the swelling in the brain and the liver, and it's normally occur after an viral infection. To make her feel better, you can give your child the food that are easy to swallow, such as soups or porridge that are warm. It is important to prevent dehydration by regularly reminding them to drink water or offer them their favorite drinks or juices. This is because that now your child has lost appetite, so offer them their favorite drinks can help her to gain enough energy and maintain blood pressure. But they are not encouraged to drink juices like orange or lemon juice because they are acidic and this can cause the symptoms become worsened. If the ulcers are causing too much pain, try soothing them by giving some cold treats such as ice cream or jelly. You must remember to not pop the blister as they contain contagious fluid which will contribute to the spreading of the disease. Hygiene is the key point of HFMD. Even after contracting HFMD, be sure to bath your child regularly to soothe the sores and towel dry gently to avoid breaking the blisters. It is best to avoid using harsh soaps and scrub that will further irritate the skin. To avoid contracting HFMD in the future, you can consider the following tips. Wash your hands frequently, especially before or after changing a diaper, going to the toilet, and coughing or sneezing. Cover your nose and mouth when you are sneezing or coughing to prevent the spreading of the contagious droplets. Do not send your child to daycare, kindergarten, or public place when they show some HFMD symptoms. Keep your child clean, hygiene by bathing them and washing their hands frequently. Avoid touching your nose, mouth, and hand after touching objects because your hand might be contaminated.
Oh, now I know. HFMD is contagious and it doesn't only affect children but adults as well.
Mommy also can kena.
Next time, I'll be more cautious on my personal hygiene and my daughter's hygiene so that we would be contracted by spreading the disease.
Welcome to the Q&A session. Question 1. Rashes of HFMD only appear on hand, foot, and mouth.
False.
Rashes can appear on other body parts such as the buttocks and the genitals. Question 2. HFMD does not only affect infants and children, but adults as well.
True.
HFMD is not exclusive to children. It is possible to affect adults as well. Question 3. Keeping good personal hygiene is important in preventing the infection and contraction and the transmission of HFMD.
True.
Good personal hygiene can minimize the risk of transmission and contraction of the disease. Question 4. It is recommended to give aspirin to relieve pain and inflammation.
False.
Aspirin may cause a rare but serious disease called the Ray's syndrome. If you wish to know more about HFMD, do browse through this website.